This video demonstrates the application and removal of personal protective equipment, PPE, worn by staff when completing non-aerosol generating procedures and applies to transmissible infections such as COVID-19 and influenza. Ensure you have all the PPE you may require for droplet precautions. PPE is applied outside the patient's room or cohort area. Decontaminate your hands following the 7-step technique. Put on a fluid repellent surgical mask, position straps on the crown of your head and tie above the ears. Tie the lower straps at the nape of the neck. Mold the top of the mask over the bridge of the nose and pull down to cover the chin. Do not touch the mask once it is on, and if it becomes moist or damaged, change immediately. Next, put on the apron. If there is a risk of splash or spray into your eyes, the wearing of eye protection such as a visor or goggles is recommended. Note, regular glasses are not considered as adequate eye protection. Put on your gloves and enter the room. Removal of PPE in the defined systematic manner will minimize potential self-contamination. Before leaving the patient's room or cohort area, remove gloves. Pinch the outside of one glove, rolling into the other hand. Slip fingers into the inside of the glove and remove. Dispose them into the clinical waste bin. Decontaminate your hands following the 7-step technique. Next, remove your apron by breaking the neck ties. Fold the top of the apron down, break the waist ties and roll the apron in on itself, avoiding touching the outside of the apron as it is contaminated. Dispose into clinical waste bin. Wash your hands, and if you have had close contact and/or exposure to body fluids, you may wish to include washing your forearms along with the hand wash. You may now leave the room or cohort area. Decontaminate your hands using the 7-step technique outside the room. Remove the visor or goggles if worn. If the visor is heavily contaminated, then wear gloves. Decontaminate your hands again. Remove the mask by breaking the ties at one side. Avoid touching the body of the mask. Pull away from the face and dispose into clinical waste bin. Decontaminate your hands.